This lesson will review the major muscles of the forearm that act on the wrist and fingers. Additionally, there are many smaller muscles of the forearm and within the hand which act on the fingers and thumb, but are too many to cover in this lesson. Listed here are the major muscles you should be able to identify by name, actions, and attachments after viewing this presentation. These will again be displayed at the end of the unit for your review. There are three major muscles within the forearm with a major responsibility to flex the wrist when they all work together. These are the flexor carpi radialis, found on the radial or thumb side of the forearm, the palmaris longus, which is found in the middle of the forearm, and the flexor carpi ulnaris, found on the ulnar or little finger side of the forearm. The term carpi means wrist. All three of these muscles are found on the anterior forearm and are shown in this graphic. The flexor carpi radialis acts to flex the wrist when used with the other two wrist flexors, and deviates the wrist to the radial or thumb side of the wrist when acting alone. It originates on the medial epicondyle of the humerus at the distal or far end of the humerus on the medial or ulnar side, and inserts on the base of the second and third metacarpals of the hand. The palmaris longus is found in the middle portion of the forearm and only assists with the movement of wrist flexion, though it also can tense up the tissue in the palm region. It originates on the medial epicondyle, like the flexor carpi radialis, and inserts on the flexor retinaculum, which covers the anterior or flexor side of the wrist, and also in the palm on the sheet-like tendon called the palmar aponeurosis. The flexor carpi ulnaris acts to flex the wrist when used with the other two wrist flexors, and deviates the wrist to the ulnar or little finger side of the wrist when acting alone. It originates on the medial epicondyle of the humerus and proximal ulna, and inserts on the pisiform wrist bone near the little finger. There are three major muscles within the forearm with a major responsibility to extend the wrist when they all work together. These are the extensor carpi radialis longus and the extensor carpi radialis brevis, found on the radial or thumb side of the forearm, and the extensor carpi ulnaris, which is found on the ulnar or little finger side of the forearm. These three wrist extensor muscles in the forearm can be seen on the posterior surface of the forearm in this graphic. The extensor carpi radialis longus acts to extend the wrist when used with the other two wrist extensors, and deviates the wrist to the radial or thumb side of the wrist when acting alone. It originates on the lateral supracondylar ridge of the humerus at the distal or far end of the humerus on the lateral or radial side, and inserts on the base of the second metacarpal of the hand. The extensor carpi radialis brevis acts to extend the wrist when used with the other two wrist extensors, and deviates the wrist to the radial or thumb side of the wrist when acting alone. It originates on the lateral epicondyle of the humerus at the distal or far end of the humerus on the lateral or radial side, and inserts on the base of the third metacarpal of the hand. The extensor carpi ulnaris acts to extend the wrist when used with the other two wrist extensors, and deviates the wrist to the ulnar or little finger side of the wrist when acting alone. It originates on the lateral epicondyle of the humerus and the posterior ulna, and inserts on the base of the fifth metacarpal of the hand. This slide shows how the hand can be deviated to the radial or thumb side of the hand, or deviated to the ulnar or little finger side of the hand. The two wrist extensors and one wrist flexor that insert on the radial side of the hand assist with wrist radial deviation. The one wrist extensor and one wrist flexor that insert on the ulnar side of the hand assist with wrist ulnar deviation. This slide explains the most common elbow problem called epicondylitis. The wrist extensors all arise from the lateral epicondylar area of the humerus, while the wrist flexors all arise from the medial epicondylar area of the humerus. Some activities cause overuse of the wrist extensors or wrist flexors, and therefore create an inflammation in the area of the origin of these muscles, called either lateral or medial epicondylitis. This slide indicates that lateral epicondylitis occurs due to repetitive gripping because the strongest grip occurs when the wrist is in a slightly extended position. Therefore, whenever the fingers are flexed for gripping, the wrist extensors are very active in keeping the wrist slightly extended. There are bands of tissue surrounding the wrist region called the flexor and extensor retinacula, which can be seen in the two upper graphics on this slide. These retinacula keep the many flexor and extensor tendons from muscles in the forearm that act on the wrist and fingers in place as they cross the wrist region. Additionally is the sheet-like tendon for the insertion of the palmaris longus in the palm of the hand called the palmar aponeurosis. This aponeurosis is also helpful in protecting the palm of the hand from injury. There are two major finger flexor muscles that are found in the anterior forearm. These are the flexor digitorum superficialis and the flexor digitorum profundus. They are so named as the superficialis muscle is found on top of, or superficial to, the profundus muscle. These finger flexor muscles in the forearm can be seen in these graphics. The flexor digitorum superficialis acts to flex the fingers except in the most distal or furthest joint, which is the distal interphalangeal joint of the finger just prior to the fingernail. As this muscle also crosses the wrist, it also assists in flexion of the wrist. This muscle originates on the medial epicondyle of the humerus, as well as portions of both the radius and ulna. It inserts on all four fingers at the middle phalange or finger bone. The flexor digitorum profundus acts to flex the fingers at all of the joints, including the furthest joint prior to the fingernail. As this muscle also crosses the wrist, it also assists in flexion of the wrist. This muscle originates on the ulna, and it inserts on all four fingers at the distal phalange or finger bone. Finger extension occurs at all four fingers due to the action of the extensor digitorum. Additionally, there is a separate muscle that also assists in extending just the index finger, which makes it much easier to point. That muscle is called the extensor indicis. The two finger extensor muscles are shown in the graphics on this slide, and they are found on the posterior side of the forearm and hand. The extensor digitorum is responsible for extending all four fingers at all joints, and since it crosses the back of the wrist, it also assists with wrist extension. It originates on the lateral epicondyle of the humerus and inserts on the posterior side of each bone in the four fingers. The extensor indicis acts to extend the index finger, but it is not considered a wrist extensor due to its small size. It originates on the ulna and inserts on the tendon of the extensor digitorum in the index finger. There are a total of 11 muscle tendons passing through the anterior wrist from the wrist and finger flexor muscles in an area referred to as the carpal tunnel. In addition, the median nerve also passes through this small space. A common problem in overuse of the hand in gripping activities is called carpal tunnel syndrome. This occurs due to overuse of the 11 flexor tendons passing through this area, which may become inflamed and swollen as a result, and it creates pressure on the median nerve. This causes pain in the area of the hand served by the median nerve, which is shown in blue in this graphic. This can be so painful that the hand cannot be used in daily activities, and often results in surgery to make the carpal tunnel larger in order to reduce the pressure on the median nerve. As at the beginning of the presentation, listed here are the major muscles you should be able to identify by name, actions, and attachments after viewing this presentation. It is suggested that you should begin to study for a test on these muscles by using study cards with the name of the muscle written on one side and the actions and attachments of the muscle on the other side.